by the way, everyone, Ailish is recording us today. I hope you don't mind. So those people who haven't been lucky enough to catch this session will be able to. So anyone on the trust will be able to click on it. Ailish has just put up, so welcome to QI Week. And if all of you could just mute, only because sometimes the noise in the background it can be quite substantial. And honestly, you can have your cameras on or you can have them off, whatever you feel comfortable with. You know, there's absolutely no preference. Meeting etiquette. If you want to ask a question, maybe put your hand up, and just please feel free to use the little chat function if you've got any messages or anything to say. Is that okay? So with no further ado then, can I say good afternoon, everyone? And it's absolutely gorgeous to see you all, and thank you so much for coming. So you're joining us today for the session around volunteering. I'm Maya Bain, Engagement and Volunteer Manager. So before I do anything, I want to introduce you to my wonderful colleagues who have joined us today. So Jenny Hall. Hi, Jenny. Thank you. Jenny Hall is one of our engagement and experience facilitators. Rachel Alt. Hi, Rachel, team manager. Wonderful. Steve Gascoigne. Hi, Steve. Expert by experience and volunteer. And may I introduce you to Catherine Carlick. Expert by experience and volunteer. And we have Ailish Manzoni, who's one of the QI team, who'll be our wonderful support and here to check that everything is running smoothly. Okay, so can I ask the other people who are in the room to unmute your mics and maybe just introduce yourselves to us so I know who's in the room. I'm just going to go down the list by the side of me. May I introduce A. Kapadi?
Hi there, good morning, good afternoon, sorry. Can you hear me?
We can, perfectly.
I'm Arbaz, and probably familiar to some of you. I'm just from the University of Sheffield, and just I've been working with Joe and actually Lee as well, just on microsystems. So this week's been really sort of interesting. And so yeah, this is one session I'm really looking forward to.
Oh, wonderful.
Yeah.
Welcome, welcome. And then we have Ailish.
Hi, yeah, my name's Ailish Manzoni and I'm an improvement facilitator with the quality team. Nice to meet you all.
Brilliant. Catherine Carlick.
I'm sorry, my dog's barking because Amazon man's here. Sorry. Shut Frank. Catherine Carlick, service user. Stevie G, I love you. I love everybody.
Colleen. Hi, Colleen. Lovely to see you.
Hi. Yes, I'm Colleen Scowthorne, service user and volunteer also. So I'm really interested in this meeting. Thank
you. Lovely to see you. We have Ellie. Hi, Ellie.
Hello. I'm Ellie Wellbore. I'm a patient ambassador in medical education and research. I'm also a service user and a volunteer in the trust. So excited for this, both in terms of my work role and my volunteer hat on as well. Unfortunately, I can't stay, but I'm excited to be here for a little bit.
Well, thank you for joining us. I know you're incredibly busy. And we have Gurka Langer.
Yes, hello. I was going to say good morning, but we're already good afternoon, everyone. So yeah, my name is Gurka Langer and I'm a clinical leadership fellow working with the quality improvement team and working with Rachel Old, where, you know, Rachel has been using volunteers. And I think because Steve is on here as well, isn't he? I can't see him now, but so yeah, which has been really interesting to hear about, and so it will be very interesting to be part of this session. Thank you.
Thank you. And Helen. Hi, Helen, for joining us. Helen Cowhig.
Hi, sorry I'm a bit late. Yes, my name's Helen and I'm from the Homeless Assessment Support Team, service manager there. I'm interested to find out what volunteers could do for our service maybe in the future going forward.
Brilliant,
Thanks.
thank you. And then we have Jenny Hall.
Hi everyone, Jenny Hall, Engagement and Experience Facilitator.
Thank you. Where's Lee? Lee Alexander. Hi, Lee. No, I think Lee has disappeared. Have we got Joe? Joe Evans.
Hi.
Hello.
Hello. Oh, look, Catherine looks so excited to see me. It's a good job you're on mute, Catherine. Yeah, I'm so sorry I'm a little bit late. I mean, I'm going to put my camera off if that's okay, because I have got a child at home, not great. So, but I'll pop it on if I want to talk. I am here, but rather than her be in the background.
Gorgeous to see you. Thank you for coming. I did try and speak to Lee and get Lee to introduce himself, but Lee has disappeared. Totally disappeared. Are you there, Lee? No, Lee's gone, and that's fine. Okie dokie. Mark. Hi, Mark. Thank you for joining us.
Oh, thank you. Thank you. Nice to be here. Nice to see you all. Yeah, it's okay. I'm going to, like Joe, keep my camera off because I've got a few things going on at home here that you don't want to know about.
Okay. That's intriguing now. Perhaps we do.
Yeah. Yeah, so I'm a service user and member of the Stronger Together group. That's for service users of the early intervention service. And yeah, good to be here and see you all. Thank you.
Oh, thank you so much for coming. And we have Rachel Alt.
Hello, yes, I'm the Senior Operational Manager for the Older Adults Community Mental Health Team Memory Service and Community Dementia Support Service. And I'm here today to talk about the experience of working with a volunteer in our service on a specific project. So I'm going to talk a bit more about that shortly.
Wonderful, thank you. And last but not least, Steve Gascoigne.
Yeah, nice to be here. I'm a service user and I've just been doing a short-term project with Rachel that Rachel's going to talk about, and then myself. Thanks.
Brilliant. So thank you. So the session, sorry.
I could hear you say Lee's not introducing himself. I had someone at the front door, so sorry to dip out. I'm Lee Alexander. I'm an improvement facilitator in the quality improvement team.
Thank you. Thanks, Lee. Wonderful. So the format of the day, so I've just introduced you. Let me just give you a little overview of what we're going to look at today. So I'm just going to give you a brief overview of volunteers, where we're at with them within the trust. And then I'm going to hand it over to Rachel and to Steve. And they're basically going to be talking about the project that has been running at Edmund Road, helping to improve services during the pandemic, and also Steve during this period too. And then we're going to move on to Catherine. And Catherine will be sharing her own journey and what volunteering has meant to her, how it's given her the confidence to move on to other things. And then I'm going to briefly look at the volunteer policy and the reimbursement policy, and then I'm going to open it up to any questions. Okay, so here within the trust, we currently have on the books, officially we have just over 100 volunteers. That comes and that goes because some people leave and then we get new people who are going through the process. So 100 is what we've officially got today. It could be 101 tomorrow, it could be 102 tomorrow. Obviously, COVID and the pandemic has brought in itself an awful lot of restrictions, and a lot of them have been placed on our volunteers. So the wonderful things they used to do, a lot of our volunteers just can't carry out some of those volunteer commitments, especially on the wards, and especially in some of our homes where we do have the pandemic, etc. With Rachel and Steve, they're going to show you how we've been able to utilise volunteers in different ways, and that's capturing feedback, but through a different way than simply face to face. So people will often say, well, what do volunteers get up to within the trust, and where are our volunteers? So within SHSC, volunteers are scattered all over the trust. We have a substantial amount, and actually new ones have come through within substance misuse, and they're what we call our service user ambassadors, and they're volunteers, and they work specifically within substance misuse. We have volunteers within brain injuries who do a wide array of different things. Ellie's nodding there, including facilitating groups, carrying out research, helping to run some of the networks. They're also currently involved in doing mock CQC inspections, and that's specifically over at brain injuries. Ellie's just put brain injuries group of fab. And then we have within dementia care, and that's where Steve is a volunteer, and he's been volunteering within dementia now for too many years. And Steve has currently been volunteering over at Woodland View, supporting the activity coordinator there and doing an absolutely brilliant job. We've also got our volunteers, including me, because some of us as staff members are also volunteers, where we read literature boards. Steve is also one of those volunteers as well. So we have volunteers scattered across the trust in Forest Close, in Forest Lodge. A lot of our volunteers prior to the pandemic were absolutely wonderful, supporting our OTs on the wards with ceramics, with art, with just about everything else. A new volunteer's starting, and it's probably a good time, and he'll be involved in walking groups. So it's really trying to look at doing things differently. Catherine, who you're going to meet later, she has volunteered in a wide array of different areas, including microsystems, but also Catherine is prolific within recruitment panels. And that's where Catherine will sit on recruitment panels with other managers, and that's at all levels within the organisation. Some of our service users co-chair some of our networks. Steve Dexter co-chairs with me Sunrise. So that's just a little flavour of some of the things volunteers do. And Jenny and I, who I'm working closely with, we're going to start looking at really trying to develop different ways that people can be involved. So, with no further hesitation or repetition, may I say, Rachel and Steve, please take it away.
Hello. So I'm really pleased to be here today, and I think I've been on an interview panel with Catherine as well. So yeah, people do prolific work across the trust, and we've been really pleased to have Steve Gascoigne as a volunteer. So basically how this came about for us, I'll just explain the process and how it came about. So we were wanting to do the COVID staff survey. Sorry, we were doing the COVID staff survey and also the COVID service user survey. But for older adults, we felt, because we obviously have people with functional mental illness and also people with dementia, that we would include carers in that, because we wanted a broader perspective. So working alongside Gurka from the QI team, we adapted the survey to fit our client group. We were particularly interested in wanting to know how people had coped through the pandemic, get a flavour of how they felt our service had supported them, but also to find out what gaps there were for them, because obviously we've had all the groups and places that people were supported out in the community were closed for quite some time, which has obviously had a major impact on people's mental health, and particularly for older people with dementia. I think we're finding that, as I say, people who normally were well supported, there's a lot of pressure on carers because they don't have their usual support. So we've got the survey and we were looking at how we could possibly do this. Obviously, we're looking at sort of capacity in the teams and who could do that. But also we wanted to be a little bit more creative and involve others in the team. So we were pointed towards perhaps having a volunteer, which I was very pleased about. I've not had a volunteer in the team before, and sort of the barriers you could think of are time. Well, how on earth have we got enough time to support a volunteer? And so I think that sometimes in a team can be a barrier, that people think, I just haven't got time to have a volunteer. But we wanted to do that. So when I suggested it as well in a leadership team meeting, it was concerns about confidentiality. Are you sure that's all right? Someone who's not in the team ringing our service users. So I was able to say, having looked into the volunteer process, that volunteers go through a full programme of induction. They have extensive experience, and I actually didn't know there were 100 in the trust, volunteers in the trust. So I don't think people in teams are quite aware of the role of the volunteer. I'd like to see more people on this actually, but I don't think they know how many there are and what their role is and what they do and how they contribute. I think we can be quite insular and quite narrow in the way sometimes that we see our services. So wanting to be more inclusive. And the other one was, well, what happens if a situation arises with a service user that the person can't handle? So it was looking at how do we put in support for the individual coming in to do the volunteering, making sure that someone was always around as a go-to person. We also have a duty system. So I would say there was some concern and anxiety among some quite senior members of the team in terms of having a volunteer. So I think I've been able to show that isn't a problem or a barrier. And also that this volunteer was not an older adult, so that I think people are very familiar with having service user involvement of people that are of the client group, but not a volunteer that certainly isn't over 65, are you, Steve? I can see you're not. And so there we said actually that Steve's experience, he's got a wealth of experience in mental health issues, in older adults specifically as well. Also, I know in your personal life, in your family. So you've actually got extensive experience and excellent communication skills. So that another one was a query from staff, but we managed to overcome that as well. So Steve joined the team, and we looked at an induction that we do to someone coming into the team. So he was given a fire induction, display screen equipment. We did that. We did a DSE assessment, introduced to the team. He was given access to a laptop and an email address, the trust email address, so that he could submit the information. And then we worked with Gurkha from the QI team on with the survey and with Steve on how he submitted the data. So basically, Steve was ringing up either carers or service users that were identified by team members on their caseload that they felt they would appreciate a call or would be able to assist us with our survey. So that was the equipment given to Steve, and also most importantly, plenty of tea. He required plenty of tea. So Steve, obviously, as we've heard, is a very busy man. So he came to us over a number of weeks that fitted into his schedule, and he had a list of his own and was able to submit the evidence, the completed surveys directly to Gurkha. So he was working with us, but also directly with the QI team as well. So let's think where I'm at. I'm just double checking where I'm at. I've got a little checklist. Yes, I've done that bit, done that bit. So yes, so we have now completed the survey. We've got a good enough quota that we can get some excellent feedback and results, and Gurka is going to be feeding that back to the team. And I think we'll also be saying about how we've done this, about volunteering, etc. I think alongside when we're feeding back to staff. And Steve would hopefully will be involved in giving some feedback or receiving the feedback as well. So going forward, Steve completed that project, but I think it's certainly opened the possibilities of say using Steve again. We have a relationship now with Steve, maybe to do some one-off small projects. We really want to look next at at our internet. We didn't realise that we get around 200 hits per month on our intranet. So that's people from the outside looking in intranet. And that's a hidden thing. So we're keen to know whether what we're putting out to service users, carers, the public, that is written in the correct tone, that we've got the correct information, and that people we'd like to look at getting some feedback on how that is for people out in the public and our service users. And we'd like to ask Steve to look at it and give his perspective as part of that project that we're doing. So yes, certainly would like to use Steve in our services again to help us, but also open to other volunteers. Now we've had a volunteer, and I think it's not just about myself, it's about the team being confident and understanding the role of the volunteer. And maybe we now, having done it, can have a volunteer that's maybe newer to the volunteering programme, because we're more experienced in that as well. So I'm going to hand to Steve now, but just to say we've had an extremely positive experience. It's been, I think, excellent for our service and our service users. And I'd like to hear from Steve how it was for him. Thank you, Steve.
Oh, thank you for that, Rachel. I'm all glowing. I'm just wondering about time, Mark, because we started late. Do you want me to be really try and get it done quite quick? And I've got some crib notes. First of all, I thought I'd briefly go through the mechanics. I mean, some of it is maybe a bit repetitive with regard to what Rachel has said, but basically the survey I did consisted of 13 questions that were kind of quantitative sort of data. You know, they were kind of rating sort of choices, you know, sort of A, B, C, D sort of thing. You know, was someone helpful, very helpful, unhelpful? But then a few of the questions also had any other comments. But what was really great was that we built a script together, myself and Rachel, that what I would say to the service user or carer answering the phone, and we created one together. But then I have to say, when my confidence did build up, it became more naturalistic, and I did ad-lib and use my own words, which was kind of nice because I can get very tongue-tied when I'm nervous. What was also very helpful was the way Gurka had designed it with QI, in the sense that at the end of each survey that I did, I followed an online link, but there was just a submit at the end of each survey. So for someone like myself who's not great at IT and would have worried about all the filing and then compiling everything together and then sending several at the end of the day, that was fantastic design. So that really did help me out. And one of the other lovely things about the team at Edmund Road was people were very friendly, but I was also not mollycoddled. I was allowed to get on with it, which was, you know, really important to me. They were very helpful when I needed it, particularly setting up the laptop with the phone system. But you know, after a couple of times, even I managed to get on top of that. So from an IT point of view, they made it very user friendly. So those things were really good. I mean, with regard to the survey, we managed to get 11 completed ones out of 28 names supplied, and some days you get no one and work really hard, and another day you go in and get sort of 3 consecutive ones in half an hour. So it was very hit and miss, but I think that it reminded me that this is just what the real world in surveys are like. And after my perfectionist traits at the beginning, I actually got on board that you're just being silly that you're going to get all 28. And again, for me, on a personal level, it was good challenging that uncertainty, and that if I didn't get an incredibly good return rate, it was somehow said something about me. I think I got more attuned to the real world, as it were. Sorry, looking at my crib notes. I mean, Rachel's eloquently gone through the benefits for the older adult CMHT, and I don't want to be presumptuous, but that was lovely feedback. I'll have a celebration tonight. But the benefits for me, I know this is very, maybe a bit narcissistic, but there were benefits for me, which was really good. As Maya said, I'm involved with the old, I'm involved at the Michael Carlisle Centre, and I do the reading groups, or used to help co-facilitate them on the older adults and the kind of working age wards. But with COVID, that's disappeared. And then at Woodland View, they've been really good. I'd been allowed to go in, but after a recent outbreak, they had to give an all clear, you know, from the last case. So I'm hopefully going back next week. But I thought it was really good for me that it gave me some sort of replacement, something meaningful to be getting on with. And I think the other thing was, although I'm nervous all of the time and a bit downbeat, with the reading groups and the dementia work, it's very here and now, and that really warms my heart. I'd have to admit that I've always found doing surveys and notes and things like that, I've always felt very secondary for me, because I just can't feel it in the same way, the warmth of dealing with people. So I think that was really, really good for my self-confidence as well, that although I was quite slow and methodical, I did manage to get through it, and that was great. And the fact that it was time limited was also useful. Yes, sorry, I didn't need those notes. I just jumped ahead after all that. But I would like to possibly do more work at Edmund Road. And I think one of the most beautiful things is the add-ons. I know very much with a survey, it's about getting the survey done and not giving too much away, particularly something that's quantitative rather than qualitative. But there were times when people were talking about their situation in COVID-19, where as a carer and a service user, if I thought it neatly came within the conversation, I would do, you know, a bit of validation and kind of display a bit of empathy. And that to me was a beautiful little bit that'll always resonate, that even though I might never hear from those people or speak to them again, there was just that beautiful connection for a few minutes and just being able to validate. So, and finally, Rachel had also mentioned the tea, but I was going to make a remark about that. I got a massive mug, more like a bucket, so I was happy as Larry. And it was just nice, the other thing with COVID as well, I'm seeing work colleagues less face to face. So even when it was just coming in and out of Edmund Road, it would just be a nice little chat, how you doing? Oh, have you seen friends or family? The kind of normal everyday conversations. So again, that was a little lovely Brucey bonus at the end of it. So thank you.
Steve, thank you. That was absolutely lovely. So I am just so, and I hate to say this, I'm just so conscious of time, because my dear colleagues are sort of, I know how hard they've worked this week, and they are back to back in different things. So thank you, Rachel. Thank you, Steve. It was just precious and beautiful. And I'm so glad we've got this on recording, because for me, there's so much I can learn. I always think everywhere wants a volunteer, and absolutely that's not the case. So I've learned so much today, and it was just poignant, and your words just make me want to cry, Steve. So thank you, absolutely beautiful. And some of the comments, I think Joe's totally summed it up there. Invaluable, Steve, thank you. So may I say, over to you, Catherine Carlick.
Joe, I think your fireplace needs polishing. Anyway, I just want to thank Rachel, actually, who made a really, really honest point. I think managers do struggle with the concept of service user involvement, and I think trust is probably quite a big thing, and it's not talked about enough, and I don't think there's enough honesty around that. And I think you've worded it very well, Rachel. I think you've worded it in a way we all understand, but it's like that elephant in the room when it comes to volunteers. And I felt it myself quite a few times, where you can feel these people, it's like walking on eggshells. So I want to thank you for that, because I think that was really honest. And yeah, Steve, I think you've proved beyond doubt that having a service user involved in whatever project it is, how big or little, is invaluable. And it's not easy for managers, because I know that one or two have had quite a bad experience with certain people within the trust that are volunteering, and it's bound to put people off and think, I can't go through that again, or I can't trust volunteers again. But I think now we're left with the pick of the bunch. I think the volunteers that are in the trust at the moment, I think, are the cream of volunteers, and I'll put Stevie on that pedestal because he deserves it. But going back for me, I've been volunteering within the trust now, probably about nearly 10 years, is it, Maya? Something like that. And I came from a premise of that I was never going to work again, that I was never going to be involved in any kind of meaningful life, or indeed job or anything. So I felt it was my job to prove beyond doubt that I could be trusted, and that I wasn't the person that was the person that I wanted to leave behind and prove myself. And I had to do that, and I'm glad that I did that, and it wasn't easy. But the payoff from that has been incredible, because now you know, I'm paid by the trust to do a job in terms of training. The lovely Maya has supported me be my manager, volunteer manager, from the day I walked into the trust, really. And she has nurtured me and educated me, and I'm so humbled. I always say I'm so incredibly humble to be where I am today because of the support I've had from lovely managers who trust in us, to colleagues. And I do feel like a colleague. I've got a dual role in the fact that I'm paid to do the respect training, but I'm also a volunteer, so I've got a dual role. But it gives me a perspective from a staff point of view and a service user point of view. So Rachel, you talk about us interviewing together. So important within the trust to get a service user to volunteer. I probably can't reiterate enough in the time that I've got how important it is that we are on every single recruitment panel. And it astounds me really, and again, this was your honesty, Rachel, I think it astounds me really how volunteers are not recognised about what we can do, about the amount of volunteers that are in the trust at the moment, and the wealth of experience that we can bring to an interview. And, you know, there's been times in the past where I've had to go and speak to Maya and say, I'm really struggling, Maya, because they want to appoint this person. And I know that they're the wrong person. I know that this is wrong. This can't happen. And I've stuck to my guns within the interview. And on a couple of occasions, my voice has been heard. And it's good. You know, we've employed the right people. And I don't think we could do that without service user involvement. I just really don't, because you get that feeling about compassion if you can work with this person. And 99.9% of the time, it's right. It's absolutely right. So I think for me, I don't know how Stevie or anybody else feels about it, but for me, I would like to see more of volunteers getting together, having our own. I often laugh and think about it. At school, we had a sixth form room and all the sixth formers would meet in the sixth form room. But I'd like a volunteer hub where we can help and support each other and share information. Now, you talk about Sunrise. I know Sunrise can be like that, but I'm thinking more, I don't know, something where we, like me and Stevie, obviously through the pandemic, we've not seen each other, but there's a lot of information sharing that we can do. And I'd like sort of a volunteer sixth form kind of hub type thing where we can share information and support each other and find out what's going on in the trust. Stevie, you've been writing the most beautiful cards to me over the pandemic. I had no idea that you were involved in any of this. And I feel quite ashamed, actually. But I didn't know that you were involved in all of this, and I've got to take my hat off to you. It's wonderful. So what else have we're not utilised enough, and I think there are a lot of barriers to having a volunteer that come into your team for the reasons that I've explained, and also as well there's that tokenistic element of it. Doesn't happen very often. A couple of times it can happen, but the trust, all in all, the trust has supported me and my lovely colleagues, service users and other, to move forward, to get to where we want to be. And I I can't thank the trust enough for that. And I think under these difficult circumstances, I feel so humble that the QI is happening, that, we're looking for ways to improve stuff. Maya, you're a wonderful volunteer manager, and I've always said it. And I agree, manager input is certainly one of the most important things. We need to be managed and we need to be supported and guided in order to help our managers and make the right decisions in these teams. I could go on all day if you want me to, but probably not best to. So that's really it from me. I can't add any more, Maya. I've done it for 10 years. I've met the most wonderful people. I've done the most wonderful work. I've stopped in hotels. We've won awards. I've stuffed my gob. I've shown myself up dancing, and also, I've just had so many wonderful opportunities that I'm going to put on my gravestone. So, but yeah, so I can't say enough. But managers, please, give us a chance, because we can be professional, and we like to get on with it. As Stevie G said, we like to get on with it. So that's all from me, really. I don't know what else to say, apart from Amazon man ain't been yet.
Catherine, it was absolutely brilliant. Now, I can see my colleagues. I don't know who had the hand up first. I can see Rachel and Joe's hand up. Rachel, would you like to? Thank you. Wonderful. Rachel. You're on mute, my love. You're on mute.
Catherine's very inspiring, and I've seen you speak to large groups of people from the heart, and I find speaking in public, or even on here, very anxiety provoking. And you do it with absolute ease. And well, anyway, just to say, I really admire that. But I was going to just go back to the bit about on interview panels. Should we be linking a bit more with HR and the recruitment team? That I think it's Georgina Hanson that's the recruitment manager now. That should be something that's offered with through recruitment as part of every recruitment. That we would like you to have a volunteer or a service user on that panel. Is there a way of linking that a bit more?
You can if you come through the engagement and experience team, we have a number of our service users who are trained. They've done the same.
I'm thinking in terms of, we usually do have a service user on the panel, and have done in a standard for a long time. But I'm thinking about others that maybe don't. Maybe the recruitment team need to prompt and say, have you considered a service user? So it's coming from the recruitment team out to
Yeah.
So I'm wondering if that might help.
I think they currently are. They're also currently really promoting the BAME as well.
Yeah.
So they also want that. So I think they are trying. I'm not sure. I always thought it was compulsory.
No, we've had a couple of recruitments recently, and it's not mentioned. So I just wondered if that was something that we could work with.
Yeah.
Recruitment into. So it's part of, right? You're have you considered a service user or a volunteer, and it's pushing it as being more of a standard? I think it generally is.
Yeah.
But I think, and also with the COVID pandemic, people, I think they're skipping having a service user on a panel.
Yeah.
At this particular time, because again, barriers we talked about, time and all that, and you're not able to do face-to-face in the same way. So yeah, it was just to say.
So I think we've got about 1 minute. May I sort of push it for 2 minutes, please, Lee? 2 minutes.
No. Mark Wright's added a comment. He can't raise his hand. So
no. Yeah.
Mark.
May I invite Jo? Jo has had her hand up for some time. Jo?
Thank you. So I was just trying to take my click all the buttons, hand down, mute off. So yeah, a couple of things actually. So yeah, just going back to the interview panel stuff that Rachel was just saying there. Yeah, I honestly thought that was part of the process. Obviously, having been working with you, Maya, over the last couple of years. So if it's not, and I totally hear what you're saying in terms of COVID comes and it's another barrier that's added, and actually it shouldn't be. It hasn't been for these meetings. It hasn't been for a lot of the stuff we're doing, which leads me on to the next bit that I was going to say is, Rachel, I think it'd be brilliant for you to do like a little promotional video. You know how we're doing that way? Don't look like that. You're on mute, so you can't say no. But you know how you're getting Beverly Murphy is doing a lot around promoting things at the moment. That seems to be the way. And I think what I've heard from you today, and Catherine totally, I think everybody has. I think for you to say what you've said, is absolutely. I mean, I don't know who was on the presentation this morning, but I did a presentation this morning around involvement of service users and some of the obstacles, and a lot of what you've said came up. And actually, how good is it to hear somebody who perhaps had those thoughts, has overcome them, and is where you are? I think is far better than, with all due respect, myself or Maya or somebody who's in the team. I think for you to share something would be absolutely fantastic if you'd be willing to do that. I'll leave that with Maya and you. And I think the third thing that I just wanted to say was about the hub that Catherine mentioned. I seem to remember, gosh, it might even be a couple of years ago, Maya, I'm not sure. This was mentioned, I think. And I think it was something that seemed really, there was a lot of energy behind it. And then, as with anything, a lot of things come and go and whatever. And maybe it is something that we could start up again. Could be volunteer led. So we don't need to build it into ours, actually, let's have a volunteer lead it. And oh, Catherine's nearly falling off a chair, look, with excitement. But I mean, I think, perfect time to start these things. And when we can meet in person again, we can go, we can extend that a little bit as well to being online. But sorry, I've talked loads, and I'm conscious Mark can't put his hand up. So he's probably sitting very politely waiting. I'll mute myself. Thank you.
Mark, would you like to? I'm so sorry your hand can't go up. Would you like to have your comments shared?
Yeah, thank you. Just quickly, because I know it's short on time, just a couple of things. I think brilliant hearing you all speaking so passionately, committed, with humour, and what a credit to the whole service and service users that that you're involved with. Brilliant. Also, just an observation: how many managers are here in this meeting who have responsibility, who have the authority to take on a volunteer, in the clinical teams? How many managers are here in this team, in this room?
I just Rachel from the clinical. Rachel's you are a clinician. Well, you're from the clinical side.
Well, yeah, older adult services.
Yeah, and we know your commitment to volunteering, loud and proud. But doesn't it speak volumes that there's no managers here who are interested enough, you know, to think, oh, you know, service user involvement, volunteers, let's pop along to this meeting, find out a bit more what it's about. And none are here. And it seems like it's you guys that have got to go to them and say, hey, you know, what about a volunteer? And there's a mismatch, isn't there?
Mm.
There's a gap, you know, a big one.
Yeah.
That you know, I mean, I don't want to do everybody a disservice because, you know, EIS have got, from, you know, my experiences, that there is a commitment to through our group, and that's been, you know, that's been very good. But I think it's very telling, you know, that if there is a commitment, or is there, you know, if there is a commitment to taking on volunteers, then it needs embedding within the trust, you know, much further, because people can't keep saying we don't have the time.
No.
And you know, Catherine's really clear, straightforward description there of the barriers, you know, are clearly there, and that's the thing to try and get across and try and overcome. Anyway, I'll leave it there because I know time's tight. So thanks for that.
No, that was absolutely wonderful, and I think Joe's idea about poor Rachel's face when Joe said it. I mean, that is going to be captured on video, Rachel. It was a look of horror, But I think that was amazing. So I think we're going to have to wrap up. So can I say, gosh, thank you so much for coming, and it's been a privilege to hear from everyone, and thank you. Yes, brilliant. So have a great rest of the day, and thank you all for coming. Bye. Thank you.
Bye.
Bye. Thank you very much. Bye-bye.
Bye.